In 2005, my son Scott died of Burkitt's lymphoma in London. He was 31 years old. The first cases were officially diagnosed by Dr. Burkitt, an Irish doctor in the 1950s in sub-Saharan Africa. Little is known about Burkitt's lymphoma in the West, so that's why I've come to Malawi. Here this disease infects 1 in 5 children. I really want to learn more about its origin and see what can be done to help the children who are suffering from this disease. Scott's treatment at the Royal Marsden, well, this is now 5 years ago. It was quite dramatic because he'd been flown in from New York, having had a major tumour removed in New York. He arrived in an ambulance and was rushed in to the hospital. But they then took at least, well, it seemed like 2 weeks, just as they'd done in New York, absolutely making sure it was Burkitt's, because it's one cancer that needs very particular protocols of chemotherapy to arrest the disease, and because it's so aggressive, they were concerned. So it was very dramatic, it was very worrying, and I remember Scott, the first day we arrived, when I went back to the hospital, I left him just for a little while to go home. And when I got back, he was completely traumatized because they basically had really told him the truth about the disease for the first time. Scott's cancer came back after 3 weeks remission at the end of the 3-month protocol. So he went back into hospital and again really was stuck in the hospital because it was a fight against time, because his tumours were growing, the lymphoma was growing so fast. He was having bone marrow tests, he had all the spinal insertions, so that the last months of his life, which brought him up to November, was pretty traumatizing for him, because they kept saying, we don't know what to do next, we don't know which chemotherapies to use. He was really like being used as a guinea pig, because they were trying to find a combination that would arrest the disease, but what would happen, it was like giving it food, it would just sometimes accelerate it. So his last week in hospital was when we were thinking we were going to have a bone marrow transfer. This was the last kind of hope. They called it the window of opportunity. It meant that they gave him even more chemotherapy. I don't think Scott really wanted to do it. I think he only did it for us. And really what happened, the chemotherapy killed him. I have nightmares about his last week of his life. It was not a happy time for me to see him in such pain, his body not working at all. But he was remarkable. He remained very peaceful. And it was very dramatic when he died. His body just shut down. And his last words were to me, "Mum, I really, really feel ill. I really feel ill." And that's, his body shut down. And his actual last words were, "Please, Mum, don't let them move me. I'm in such pain." I'm sort of preparing myself mentally and emotionally about going into an African hospital and seeing very sick children with Burkitt's lymphoma. Just thinking about when I obviously physically first see children with Burkitt's, because I know it's so visible, and I know there are some very upsetting cases where the tumours are actually in the eyes of the children, which is going to be quite horrifying to see or upsetting to see. But, and I know this again from experience, I very much do not want to react and show any kind of that I'm upset. I want to make the children feel there's nothing different about them, that they, you know, they may have this awful disease, but they're still that person. And I just know how important this is. And the last thing I think even a child and a human being wants to be reminded of what they've got. They want just to have that feeling that people are there to see them and that they happen to have this ghastly, awful disease. And one's there to make them feel better, that the day is worth living, and there's hope. Can you give me a brief overview of Burkitt's lymphoma in Malawi?
Burkitt's lymphoma is the commonest childhood tumour in children in areas of Africa which has a lot of malaria. So it's not throughout Africa, not quite so much in the north, not quite so much in the south. It tends to be where there's heavy rain, where it's hot, and of course, that's where we get malaria. It's associated with a virus called Epstein-Barr virus, and probably throughout Africa, children get that virus much earlier than they do over in the West. In the West, it causes glandular fever, and that tends to be something that teenagers get. Whereas here, I think, we don't even know when the children get it. It's probably a very non-specific viral sort of upper respiratory tract problem before the age of 5, and certainly sometimes before the age of 2. In Malawi, it's our most common tumour. We would say probably about 60% of the tumours that we see are Burkitt's.
What distinguishes Burkitt's lymphoma from other cancers?
Several things. And when you think about cancers, Burkitt's is remarkable for how quickly it grows. It's the most rapid growing tumour known in man. It doubles its cells every 24 to 48 hours, so it's very aggressive. It has peculiar places it tends to present, and the one that's very well known and is quite common is on the jaw. So you'll get a big lump on the jaw, or maybe upper sort of cheek here, behind the eye, pushing the eye forward. In the abdomen is a very common place, but actually you can get it virtually anywhere, but those are the common places. And I think what really, and of course the age that you tend to get it, it tends to occur, there's a little peak round about the age of 6 or 7, and then another one in early teenage life. They do tend to be rural. They do tend to be in areas where there is a lot of malaria. I'm just asking her to turn around a little bit. Right, yeah. Actually, she had just turned a little bit this way. She had 2 big swellings on each side here when she came. And her teeth were displaced. You can see they're still a bit displaced. Yes, yeah. And she's she's very near the end of her treatment, and she's done very well. Her eye is something from the past that's not to do with this. And when we do a lot of other investigations, we look at fluid from the spine, we look at bone marrow, we look at blood to see if it's spread anywhere, and we do an ultrasound of their abdomen. She was clear, so we're hoping that she will be completely successful. So this is Edina. Edina's 13 years old, and she came to us with severe difficulty breathing. She actually had fluid on her lungs. When we felt her tummy, she had a lot of fluid there with lumps in it. Very short story, just a month or so. Right sort of age, actually, for Burkitt's, particularly when it presents in the abdomen. So it was a matter of treating her quite urgently. She's nearly finished her treatment, which has taken a month. And she's done remarkably well. Ukupuma bwino tsopano, ed? Ehe. Ukuyenda bwino, kusowera, kudya, kusangalala. Asking her whether she's eating well, walking, whether she's happy, and she's agreeing to it all. Yes. So she had fairly advanced Burkitt's lymphoma because she had a lot of fluid in her abdomen as well, and of course that fluid has a lot of cells in it which may spread. Our treatment is nothing like as intensive as it is in the West. I don't think our children would tolerate it. We don't really have the supportive treatment to manage it. And we're finding that we're getting about 48 to 50% complete cure, which means a year with the treatment that we're giving, which, as I say, takes a month. The drugs cost about $50. That means we can treat a lot more children than we would if we went in for very intensive care, very intensive therapy for 1 or 2. And yes, we're quite relieved with what we've been able to do without causing a lot of severe side effects.